What if the key to better wellness wasn't in another prescription bottle, but in a carefully cultivated plant, grown organically, extracted responsibly, and backed by science? The problem? The CBD industry exploded before the rules did, thanks to a patchwork of state laws, a 2018 farm bill that left gaps, and the FDA's continued reluctance to evaluate or regulate CBD products like dietary supplements. We've ended up with confusion, chaos, and a flood of products making claims they can't back up. Today on Just Say No, we're cutting through that fog and getting real about what's in your CBD and what shouldn't be.
By 2020, Bank of America and Merrill Lynch estimate that will grow to $35 billion. And many experts believe it could eventually reach $200 billion each and every year.
Hello, and welcome back to Just Say No, where today we are going to take the mystery and the marketing spin out of cannabis and hemp products. I'm your host, Maria Calabrese, and I am excited about today's topic because it addresses something near and dear to my heart: transparency and wellness. I'm coming to you from the heart of California's cannabis country on KCAA Radio, 1050 AM, 106.5 FM, and wherever you get your podcast. With so many CBD brands claiming to be pure, organic, or doctor recommended, how do we as consumers separate the truth from the noise, the hemp from the chaff? Well, one company that walks the walk is Aspen Green, USDA certified organic, full spectrum, and physician formulated by one of the most respected names in integrative medicine. Joining me today is Brandon Lewis, the founder of Aspen Green. Brandon's mission goes beyond selling wellness products. He's here to raise the standard and help us all become smarter CBD consumers. Brandon, welcome.
Well, thank you for having me, Maria. It's a pleasure.
I have been looking forward to this conversation, not only because we're welcoming Aspen Green to the Green Bee Life Hive, but because I think your story and the science behind your products can truly empower our listeners. For those who may be new to Aspen Green, tell us how it all started. What led you and your co-founders to step into the CBD space, and what problem were you hoping to solve?
Boy, oh boy, that is a loaded question.
A lot to unpack.
Yeah, so look, I'm not going to get religious on anybody here, but I will tell you that I literally was asking from above for something that I was passionate about and that would fulfill me for close to a decade. Now, I am a recovering alcoholic addict. I'm sober 28 years, and I ended up in a business where I had an executive search firm that was tied to pharmaceutical marketing and healthcare advertising. And during this time, when I would ask my clients, I would ask them about therapeutic categories of expertise that they would require to have and so forth, and different skills that they're looking for when they would bring on whether account talent or scientific talent into their organization. And my stomach really started to churn somewhere around 14, 15-ish, maybe 16, when I had clients that were in the pain space. In particular, we're promoting opioids. And so with that, I just didn't want to be a part of that any longer. I didn't know how I would end up over on this side of the, this business. I've been passionate about prison reform, decriminalization. I believe that people need to go to treatment centers and get help when they have any addiction. And I did not grow up as really a cannabis lover. I didn't. I used to have a retail chain a long time ago when I was in my early 30s. I did business in 8 states. I had 1,000 employees, and I like the action, but that business was really about the money. It wasn't necessarily helping people per se. And when this came about with me, probably the first moment that it made me really pause and think was in 2012. I was in Colorado Springs, and I had stopped off at a dispensary right off of I-25. And selfishly, look, I'm a male. I've been married to my wife, Heather, who's involved in the business for, I don't know, what, 23, 24 years now. And I heard that you could have a good time with your intimacy, if you will, if you've got a buzz from cannabis. So I stop in at this dispensary, and it took every bit of 45 minutes. I get out and, I get back into the car, and Heather says, what took you so long? And I said, babe, you don't understand what I just saw. I saw every walk of life. I saw every demographic. I saw people who do want to get absolutely buzzed. There's no question. But I saw so many people who are looking for, help from their ailments. And again, I want to be very cognizant. I know I mentioned I was in executive search tied to pharmaceuticals before. Well, we're not making any claims, right? So we're not going to tell you that we're going to help you, quote unquote, with pain or with your other ailments where the FDA is involved and pharma can pump out a drug for you. But these are natural remedies, if you will, from this plant that's been around for thousands of years. And it was really eye-opening to me to see that in 2012, where people were really, really looking for relief from a variety of their issues. And, it took a few years still where I had to go on a journey where I thought, you know what, why don't I open up these marijuana dispensaries, medical marijuana dispensaries? And I really was disheartened because it is so stinking political, and every state is doing it differently. Look, we're a lover of Colorado. Everything that we've been doing has been based out of Colorado, from soup to nuts, growing the plants, extraction. Rebecca and Stephanie, who are on this call, live out there. Our teammate Adam Young is in Colorado Springs, and with that, I live in Florida, in a town called Ponte Vedra Beach, which is a beautiful place, and I go out to Colorado all the time. But with that, I really got disheartened in these state sessions, both in Colorado and in Florida, in having it be vertically integrated. You have to do every single thing under the sun, and you have to retail directly with, brick and mortar and so forth. So fast forward through that, I was sharing my zest to explore this medical marijuana space with a friend of mine who's a very wealthy guy. And he came to me a couple months, maybe about 6 months later. So this is in the beginning of 18. And I'm sitting at this desk right here, and he calls me up and he says, hey, what do you think about this CBD thing? He hit me at a bad moment, and I just go, I think it's a fad. And it was a short conversation because I was focused on marijuana, right?
Right.
And I'm not understanding the difference here. I'm not a connoisseur of cannabis at this time, really. So fast forward through this, he invites me to come in and to be a distributor for another brand out there. And I started asking him, well, and that company, where are the farms? I want to meet the farmer. And they couldn't tell me. they would just say, hey, we buy material from all over the place, 5,000 farms, whatever it was, across the country. We ship it into one location. We're grinding it up, mixing it all together. It's like a hodgepodge of really biomass.
Hmm.
And I said to him, I said, this is not what I've envisioned. I have another gig that I do. I've had success, yada, yada, yada. And I really want to help people. And I want to know, like at the ground level, the strains, the farming and so forth. So fast forward through that, my we have partners, Kyle and Valerie Chong, lifelong friends of mine. I've known Kyle since we're 12 years old. He's a Chinese Jamaican guy. No joke. His mom used to grow, cannabis, and she would use it in tea, right?
Mm-hmm.
Properties to help with the various ailments. So anyway, so with that, his wife Valerie was very in tuned to these different toxins that are in skincare products, like the banned over, I think it's 1,300 of them. So this is kind of the genesis of us, where we came together, two families, homeopathic, looking for the natural remedies, and then the journey began.
Looking for the natural alternative to, pharmaceuticals or products that are packed with preservatives or not so great ingredients. There's a lot of manufacturers out there who put profit over people. And for you, it was personal. And I share that with you. I think that's what drew me. I didn't realize the specifics, but to Aspen Green, because it shines through in your products. They're USDA certified organic. They're grown in the United States, Colorado to be exact. And the care you take and the interest you have in this commitment towards sustainability, for me, it's personal too. And I really appreciate your sharing the why in such a candid and personal way. Our journeys are quite parallel. I went to law school. I mean, to me, marijuana, unfortunately, it was drummed in as a child of dare, it was a felony and a devil's drug and a gateway drug to all kinds of mayhem. But I had a horrific car accident. I had 4 massive spinal surgeries. And opioids, that is not a long-term use drug. Sorry, pharma got it wrong. Sometimes it helps, sometimes it hurts. Opioids it's just not a long-term use drug. If there's really specific cases, very acute short-term pain, but for someone struggling or suffering with a chronic lifelong condition. This happened to me after my first year of law school. I was only 24. Opioid addiction was a real threat and concern. So, but cannabis was never on the table. So for me, it wasn't until 2016 when it went on the ballot in California, and it was actually through a dog that I had. It's funny because with all of the propaganda and the misinformation, I really thought you had to go full-blown cannabis and that CBD was just a fad. I didn't understand the endocannabinoid system. We'll get into that. And cannabinoids and that THC and CBD are only 2 of over 150, at least, cannabinoids. So someone suggested marijuana, failing dog. I was that was the devil's weed. And CBD I thought was a fad, but her suffering, not my back, her suffering forced me to kind of look into it. And when I had the aha moment like you, especially in the dispensary and seeing people from all walks of life in there, and that's what our audience wants to learn more about, because they're folks who are looking for natural alternatives to pharmaceuticals and alcohol. So I wanted to just take it back to, your commitment to doing this. So so authentically and clean. Can you explain to the audience what exactly USDA certified organic means and how rare it is to come by in the CBD industry?
Yeah, well, that was something that I was. It was non-negotiable for me is to put out the cleanest products that we can possibly make. And
Mm,
so it starts really at the farm. So the
mm,
USDA has to come out and certify the actual farm. They do this on the hemp side of the business. Okay. Just so everybody's clear who's listening, this is all the same exact plant. It's called the cannabis sativa L plant. There's the only difference between what is classified as marijuana and what is classified as hemp is the actual weight of the product cannot exceed 0.3% THC. If it's 0.3001, you call it marijuana. You have to have a marijuana license. If it's at 0.3% and below by dry weight of that actual THC, then you can call it hemp. And the feds had passed the Farm Bill, also known as the Agricultural Act in 2018, and that made it federally compliant. Now, every state's doing things all differently now, too. So there's this all this stuff. It's a quagmire, frankly. But that's what gave way to this space. And with that, you can have the USDA will certify a hemp farm as being organic, but they won't do that with a marijuana farm. It does not exist. Okay, just so you know. Now, again,
and that's because of the legal classification of the amount of THC.
yes, it's all about the amount of THC in the plant. And look, and as we're growing plants, realize this, you have a buffer state by state. They give you an allowance. I told you 0.3% by weight. So just imagine this, for example. If you have a 5-gram gummy, 0.3% of 5 grams is 15 milligrams. So if that came from what was classified as a hemp plant, and it was no more than 15 milligrams of THC from a hemp-derived plant, then you are federally compliant, right? So if you're on the quote unquote marijuana side of the business, the USDA will not certify any farm as being organic. But again, it's the exact same plant. And when you're growing the plants, the term is it went hot, meaning it went over a threshold that's acceptable by the state, which typically is more than the 0.3 in a manufacturing process of growing the plant, okay? Getting the oil out, they allow a buffer for that, okay? And again, it does it differently. So if it's over that, whatever that threshold may be in the growing part of the manufacturing and production, then it's called it went hot. And now it's called marijuana. You got to burn it, whatever it may be. So, we're testing at the field level, at the farm, clipping the buds, clipping the flower, if you will. Then we're testing the biomass when it's ground up, and there's no stems. We don't use any stems. It's all the flower, all the buds, if you will, all the good cannabinoids and terpenes and so forth.
That's important for bioavailability, right?
Yeah, absolutely. You have to
remove the stems and you have the hemp flower.
Yeah, for sure. But there's also the ways of ingesting for bioavailability too.
Okay.
Right?
Okay.
So a tincture with the oil, the droppers. Smoking is the fastest way to take this stuff and get it into your system. It hits your lungs, right? The second fastest way is actually a tincture bottle, and you leave it in the back of the gum line for about 20 minutes, and so forth, and it soaks in. I want to be very careful with the FDA, all that stuff with the FDA.
Sublingually.
Yeah, you have that, and then you can drink it. We have new drinks coming out, by the way. You have the gummies, you have topicals, and so forth. But the tinctures are and we don't sell smokables. If you look at our site, I don't believe in, and I'm totally anti-smoking. If somebody smokes, that's their prerogative. I'm personally anti-vaping. I've been asked to get in the smokable space, the vaping space constantly, and I'm like, I just don't want to be a part of it.
Sure, lung health is a whole other issue, but I got you a little off track. You were talking about that you mill the hemp flower, removing the stems. on the topic of the USDA certification, and that's not something everybody does, correct?
Oh yeah, for sure. There's very few of us out there that do that because it's very costly. I mean, you're talking about you're talking about the sprays used. You have to have everything that has to be approved by the USDA as being organic and clean. Your soil. Then you're talking about the actual facility where you're doing the extraction, getting the oil out of the biomass. The facility has to be certified organic. In manufacturing the gummies, that facility needs to be certified organic. Everything from soup to nuts.
That's what caught my attention about Aspen Green, because it was a few years back that, I mean, you were one of the first to get that certification. And I knew that farms could get it, but to see that you as a product, I said, I have to check this product out. And on top of the USDA certification, and we'll talk a little bit about your manufacturing process, but you're also physician formulated, and that is another unique value proposition. I don't think too many CBD brands can say that. And can you tell us a little bit about Dr. Adam Perlman and his role in these formulations?
Well, he's formulated all of them. So,
Wow.
it is, we have to have doors open up with the right relationships, meeting people and so forth. Right. And we both have we've spoken to so many different folks in this space. There's a ton of imposters, if you will, a ton of bad actors that don't dot the I's, cross the T's, etc. So with that, a dear friend of mine introduced me to Dr. Perlman. And ironically, I live almost a stone's throw. My primary residence is from the Mayo Clinic here in Jacksonville, Florida. And so Dr. Perlman lives in my same neighborhood. We finally got introduced by a very good mutual friend. And we hit it off, and he ended up authoring a bookazine, if you will. So it's a cross between a book and a magazine, about 75 or so pages. It was published by Mayo Clinic Press. It was called, I believe it was called the Medical Benefits of Marijuana and the Many Benefits of CBD. And with that, when anybody looks at Dr. Perlman, we're not talking about just any old doc. This is an integrative functional medicine doc. He is all about your diet before anything. That's the first go-to deal.
Nutrition. Yes. Yeah.
Yeah. So he doesn't prescribe pills unless he has to. He's truly that blend of Eastern and Western medicine. And if anybody in the audience listening ever got to really meet Dr. Perlman, I mean, this guy I think he's 58 now. He has like no fat. He's unbelievable. He's shredded, in amazing shape. He does martial arts, just a really unique dude and a pleasure to be partnered with. And he didn't join us just because we became friends. It's his name. It's his career. He was at Duke University, for 5 years, leading the integrative and functional medicine at Duke University, to the Mayo Clinic for another 5 years. And so when he joined us, I wanted him to go through every formula and every product that we were coming out with, and he signs off on all of them. Yeah.
Wow. And I said something that struck me, that his biggest concern in recommending CBD is the quality of the products out there. And that resonated with me, obviously with you too, and likely with our audience. And, quality control, as you mentioned, it's still a challenge in every space, not just CBD, but when you're in an unregulated space, in a space with such the patchwork of laws that are inconsistent with gaps, then it's can be more unscrupulous, which is a shame. And that's why it's so important to amplify voices like yours and brands like yours, so that people who want to be helped by this plant and by the products know what to look for and how to find them. And not just people, but pets. Now, you don't just have, and we're going to talk about your products and formulas in a bit, and about your customer care team and meet some of them, but you also, which I love because my dog was the gateway to cannabis for me, formulate CBD for pets. And I love that your pet line. I know Dr. Trina Haza, and I know you've got an incredible veterinary board of advisors. It's really impressive. How did you attract such medical authority? So tell us about your veterinarian line and your veterinarian board of advisors.
Well, Dr. Michael Silver and Dr. Trina Haza, I got to tell you, I think it was just through constant networking. I really can't even remember. I mean, we're talking about years now, right?
Well, they're the best. They are the best, not just in the cannabis field, but Dr. Haza in the field of oncology, in their respective veterinary medicine fields. It's remarkable. You hit gold there.
Well, and those are their formulations. I didn't want to make a product that true cannabis veterinarians or veterinarians that have expertise in cannabis and hemp. It didn't make sense to me. There's so many products out there. Again, how does a consumer know what to trust, right? And that you got a flood of quote unquote brands, but there is no, dare I say, Coca-Cola in our space. It just doesn't exist. Maybe it will in 30 years. But how do we send the message to the consumer to trust a brand? And to me, it felt like we had to be USDA certified organic. It was a non-negotiable. We need true docs that have expertise in hemp and cannabis, both for the pets with Dr. Trina and Dr. Silver, and then Dr. Perlman from obviously the human side. And then let's go further too, because we didn't talk much about this, is testing. So we all want to talk about, oh, these are by an independent, all our products are tested by an independent third-party lab. Does that mean it's Maria?
That's another, you got the MVPs of the space because you guys use SC Labs, and I wanted you to talk about that. So I'm so glad you brought that up.
Well, with SC Labs, our original partner was Botanicor in Denver, which was purchased by SC Labs. Nationally recognized. Botanicor with us in Colorado. They were accredited. They were only one of 3 labs accredited by the state of Colorado. So That's right. Me, I'm like, we had to go with one of the 3, period. And, they're doing state compliance. They're doing national compliance. They're doing USDA organic compliance. To me, they are the cream of the crop. And I've seen all these other labs out there, and I'm like, who are they? I've never heard of them. A lot of them. There's a handful I have heard of, yes. But SC Labs is the premier testing authority in our space. And we've been with them, again, pretty much since inception. We were with a different lab in the very beginning for just a little while. And then when I stumbled on and I found out about SC Labs, AKA previously Botanicor, it was a mic drop. We had to go there. There's no question about it.
And your transparency is so impressive because you have such easy access to the lab results for customers. When you talk about how do consumers even begin to evaluate, and it could be overwhelming, but you have QR codes on every package, and on your website you have the lab results. Make them very, very, very transparent, and you walk the walk, Brandon. What can I say? And in terms of all of these creme de la creme partnerships, you're also partnered with the Realm of Caring Foundation, and they're incredibly respected in the space. Now, why was it important for you to align with them?
Again, I felt like it was true trust for consumers, but also we needed to have, because we cannot speak to conditions with a consumer, with our customer base who we're so proud to serve. So when they want to talk to us about the variety of ailments that they've got, and then they get into their other pharma drugs that they're taking or their medical conditions, we felt it was best to partner with Realm of Caring because they've taken over 100,000 phone calls from, they'll say, clients, not patients. And they've also done research with Hopkins, Harvard, and Penn, just to name a few. And we've donated products for some of those observational studies. And we just felt that that was the right thing to do for our consumers and educating people out there. this is a free call. They're there to help you and guide you on your journey, if you will. And with that, so actually one of their tenured guys I always had on my radar to come join us. His name's Adam Young. He's not on this call with us, but Adam was there for about 5 years, well versed in cannabis and in hemp. Again, it's the same plant, folks. So, and he was a
An
caregiver.
important distinction to make. Not everybody realizes that. Can't be said enough, but go ahead.
No, and he was a caregiver as well. He's very empathetic. He took care of his mom down the stretch. She passed. So a lot of this with, a lot of people were using RSO, Rick Simpson oil. And Adam was, and is such a caring guy. He's been with us for over 2 years. And we've got also 2 gals on the call with us here, Stephanie and Rebecca, who have been, so with Adam Young leading our customer care team, him coming from Realm of Caring and his experience was just perfect for that. But we needed to have some other really key stakeholders involved that could help our customers. And I actually had met an awesome farmer, Rebecca, was at her farm, myself, and now she's with us. It took about 2 years later, she joined us. And then Steph, who's on this call, both Rebecca and Steph are on this call. Sorry, Bonnie, you're not here. Adam, sorry, you're not with us. We love you both, but Steph and Rebecca are here. And I'm so honored and proud to have them on the team. I've been passionate about, I want to have an in-house American customer care team that can really guide our customers and who've got experience in this space. So with that, I'll let you chat with Rebecca and Steph.
Well, welcome, Rebecca and Stephanie. I could discuss education and patient support all day, but I'm going to let some new voices talk about it. So why don't we start with Rebecca? Rebecca, tell us a little bit about yourself, how long you've been in Aspen Green, and what type of patient support, or we have to call it client support, you offer to customers.
Yeah, so I'm Rebecca. I've been with Aspen Green for about 2 years now, and it's been a great company to work with. For me, my background with hemp or cannabis has been an extensive background in growing cannabis on a small and a large scale. So that background of like seeing actually what goes into growing has really made me appreciate this job, because I just know like how much effort and time and care really goes into it. My history with growing has also been organic. And that's really helped open my eyes to how insanely difficult it actually is to get USDA organic certification. It's not something that the farm that I worked with was able to do, just because it was just so intensive and also really expensive too. So that's been really nice to like work for a company that offers that on all levels. So I really appreciate that about Aspen Green. And as for the support that we give, I think that our main mission with Aspen Green is to be not only knowledgeable, but also available to customers and to our clients, just because, I mean, that's something that, in the world of like AI and computerization of everything, like people are really losing that personal touch with companies. And so for them to be able to actually like pick up the phone and call us, we'll call them back if we missed it right away. We'll respond to their emails quickly, talk to them on the chat, like just to actually be able to talk to a human being like quickly has been, I think, a game changer for a lot of people. And on that note, like even for me, if I'm wanting to get, customer service from a company and I'm like reaching out to them, just working for Aspen Green has kind of set my expectations for customer service a little more. I'm just like, dang, they haven't responded to me in 48 hours. What's going on? So I think that's our main mission, is just like educating people, being knowledgeable, caring, and also, being available for people.
Well, this is a radio show, and we're also going to have a video version. And I just love to highlight and spotlight the faces behind it, because we're crushing the stigma. You're relatable. You're lovely. I'd call you, not to sound dated, the girl next door. Unlike the stereotypical crazy propaganda reefer madness displays. So not only are you a subject matter expert, you come to it with years of experience, and it's been a gateway to helping people. So I love spotlighting the people. I like to say that Green Bee Life is a people network with cannabis, not a cannabis network with people. And I'm going to now introduce, we want to say hi to Stephanie. Stephanie, tell us a little bit about yourself. Another one who doesn't look like, whatever. Not that there's anything wrong. I loved Cheech and Chong, but, the demographic's much wider. So,
Yeah. So my name is Stephanie, and I, similar to Rebecca, have been in the industry now since 2013. I took a little bit different a path. I went more on the retail side of things. So I was working more customer facing jobs, and I worked for a company called Live Well Enlightened Health. They had no training program when I first entered. They were only medical.
sure.
And so it was crazy to see like all these different walks of life coming into the dispensary, having little to no knowledge of like what they were buying, how to ingest it, what it was going to do. And so I kind of saw an entryway of being like, hey, I can be really impactful for this company. I'm going to help them create a training program. So we developed a world-class training program that eventually turned into multiple different states. And we really saw Live Well expand at a rate that we couldn't have expected. And the coolest thing was that a lot of our reviews that were left back, in the early days was that they were coming in and it was an experience that they could come in and they could get walked through all the different forms of ingestion. We were answering questions in a compliant way, and they were leaving feeling really empowered in the decisions that they made. So it was really cool to be a part of that. I love Aspen Green because they've hired so many different people with different backgrounds. And so it all kind of formulates into this really beautiful symbiotic relationship where, Rebecca has grow, I have retail, Adam has both sides, Bonnie as well coming into it. And it's just been really cool to see how meticulous the process is for Aspen Green. And I use the products, my family uses their products, family, friends, everyone's using their products and they love it. And it's really something that I can stand behind because the USDA organic, just the care that we take with our customer service, just every step of the way is really thoughtfully curated. And it's something that I can really get behind.
Yeah. And, there's nothing more gratifying than having customers or listeners. I know today's listeners are going to walk away from this just interview, but to have an interaction with you as well, feeling more informed. That makes them feel more empowered on their wellness journey, which we talked a lot about the information gap, and there's a there's a legal gap, but those gaps in the law. And when we talk about being able to speak to the customers in a compliant way, it's tough for consumers. That's, for me, new to cannabis and having been so grossly misinformed. That's why I put together Green Bee Life, and I'm trying to build a hive of brands that are aligned and who are putting people over the profits. But, we need, it's connecting the people to the brands that are walking the walk, that are well-meaning, and that are really interested in helping the people. Then the profits will come. But the gaps in the law present gaps in information, because on the retail side and on the marketing side, how do you separate hype from marketing? But then even well-meaning companies like yourself, if you're restricted from making health claims, or, where we have barriers to social media, to putting information out. So having this customer support team, I evaluate and I look at and I search for many brands. I don't know too many that offer that. And so it's fantastic. While I have such smart people, we like to do something called a quick hit. So I'm going to have y'all drop a knowledge bomb where you guys are going to share, and you're on the spot. You're on the spot here. I'm not going to lie. They didn't know about this, guys, beforehand. but where you're going to share a fast, powerful insight. Now, I kind of would, given your backgrounds and your mission, I thought it would be great to ask each of you, and you could go around, you could take a couple minutes each, and you could take a minute to think about it. Tell me who would want to go first. Today's knowledge bomb, or quick hit. What's the one thing you wish more people truly understood about CBD beyond the hype and the misinformation? So who wants to go first? Whoops, Brandon. Brandon is brave. Brandon, you're muted.
I was going to defer to the ladies and be gentlemen. So
Oh.
ladies, you want to go with this? I mean, go ahead, Rebecca.
Okay. Yeah, I think for me, one thing that I really wish that people, okay, can I drop two?
Oh, absolutely. You can.
Okay.
I'd love you to indulge me and answer the one thing you wish more people, but then
Okay.
if you have a knowledge bomb you want to drop, by all means.
Yeah, I think for me, and Brandon actually touched on this earlier, is that like hemp, cannabis, marijuana, it's all the same plant. And I think that that's something that a lot of people don't realize. And so there's certain aspects of the plants that kind of get demonized, so to speak. You know, like a lot of people are like, oh, like marijuana is awful. I just want CBD. And it's kind of explaining to them like, you know, CBD is hemp and CBD is from marijuana plants. And it's all just about how much THC you're extracting from these plants. So that's something that I think would be really helpful. Maybe not for people to know, but like for the respect of the plant. Like I feel like it helps people to like have a better understanding of the plant and kind of the history of it. And just the terminology I think is important.
I agree. And I also think, not to interrupt, but in terms of respect for the plant, I think when you make the distinction, we're just perpetuating the propaganda and vilifying THC and marijuana. And that's got to be normalized. But go ahead. Go ahead.
Yeah, thank you. And yeah, the other one is just that it's not a like one size fits all solution, and it's not like an instant fix. And so, you know, like Brandon was mentioning earlier, it's like coming from a space where like a lot of people, I'd say most people are kind of conditioned to expect immediate results, you know, immediate relief, because we're used to like having access to medicines and things that, you know, mask the symptoms right away. And so when people are looking for like natural alternatives, they kind of have this built up expectation of like, okay, if I take this once, I'm going to sleep 10 hours tonight, or my pain's going to go away. But it's just like with any natural supplement, it takes time and patience and consistency to like allow your body to actually like acclimate to it and give your body a chance to respond. And that could take some time. So for me, that's one thing that I would just love to like shout to the world is like, give it time, be consistent, be patient with it, give it a couple of weeks and then come back. But like immediate results, like it happens sometimes, but pretty rare.
I love that. I mean, you guys are in it for the long haul, because the education and managing the expectations. And that's another thing, guys. Just, you know, if brands are making these crazy claims, they're clear. I love your honesty, and that's realistic. Thank you.
Cool. All right, Steph, your turn.
Definitely jumping off that, like the fact that we, you know, it's not a one size fits all. I think it's really important to really drive that home for sure. I love that when people get the opportunity to like talk to Rebecca or Bonnie or I, we can kind of help educate them that, you know, everyone's body is going to react differently. And so to be really open to like experimenting, not only with the different forms of ingestion, but with the different amounts that you're taking, because it is going to be different for every single person, right? What your partner takes may be a completely different effect for them versus for, you know, what you take. So being able to be open to experimenting is a really big thing, because your mindset is huge when you're entering the world of like full spectrum products or CBD in general. If you have that, you know, mindset of like, oh, I want this to be like a quick fix, and you're not willing to experiment and be open to like what happens, it can be, I don't know, it can kind of be you can kind of not meet that expectation, or you might be let down. Whereas if you're going into it with like, okay, let me just be really open to this experience, especially for new time users, right? Like when someone that is trying CBD for the first time calls, it's like, okay, this is what, you're trying. How about you try it on a day where you don't have a lot going on? You're in the safety of your home. You can be really open to what is going to happen to your body, because you just kind of have no idea. So really educating people on that. And I think another thing too, and this is something that we used to teach back in the dispensary, at least, is that people have the misconception that like CBD is like not psychoactive, but like CBD is still altering your nervous system. So in a way, it's still going to be, it may not be intoxicating, but it's still going to cause some type of difference in your nervous system. So like, it's kind of a misconception to say it's not psychoactive, because anything that alters your nervous system is. And so that was another big thing for me that we would really touch on when people would come into the dispensary looking and to learn about different cannabinoids.
Very powerful. You just get the best people, Brandon. I mean, that is such an important distinction. And I always say, like, psychoactive, psychotropic. I mean, I don't even like the word intoxicating. I like to apply the word intoxicating to alcohol because it's toxic.
Mm-hmm.
Marijuana, THC, it's got a psychoactive effect, but it's not toxic.
Mm-hmm.
So I know it's all semantics, but I hate when people say that CBD is, that's a strong word. I get discouraged when people say that CBD is not psychoactive, because wait a minute, if you're taking it for sleep or if sleep support, or you're trying to just calm stress, I mean, it is affecting the psyche, perhaps. And that's what the studies indicate as well. But so great insight. Wow.
Well, I'd like to clarify with that, because a couple times throughout our conversation, I know we've said sleep, I know we've said pain. I want to make it very clear, we are not making any claims.
No.
That we can, that we are giving you better sleep, pain relief. We're not making those claims in case the FDA listens to this. So that's why our products say rest, have a good evening's rest. You'll be dreaming all night long, however you want to take that, right? You want relief from your ailments, whatever those are, and your discomfort. You can read between the lines, right?
Well, so, it's balance, and we're not going to have time, but I got to have you guys back, because it is established that there's an endocannabinoid system, and the endocannabinoid system, there are studies, and we're going to have them on the show page, does kind of regulate certain bodily functions. And there's a lot of research to be had, and your honesty is and your lack of bias is refreshing.
Maria, your audience, the listeners here, they can go to PubMed.
Absolutely.
Right? Yeah. They can go to PubMed, and they can also go to the NIH.gov, and they can type in cannabis, they can type in hemp, they can type in THC, they can type in CBD, and any ailment that they want. And they can see a list of studies that we don't even know who these scientists are. So we used to actually have those on our site. We thought that we were good stewards in the very beginning of the business. And then we had obviously compliance lawyers, and they said, no, you're by showing those studies, you're making a claim.
A claim.
Boom, they had to come down immediately, right? So.
Well, this is where the regulation is in no man's land, but once we get to actual sensible rules and regulations, it's always threading the needle, where you want to have regulations that are sensible to promote innovation and to protect the consumers at the same time, but also to be able to inform them. I wish the FDA would stop stalling and actually evaluate it, have the NHI studies, and we'll see where that goes. But that was a really good quick hit, Brandon. I'm gonna count that as your quick hit. Unless, is there one thing you wish more people truly understood about CBD?
It's one cannabinoid. We have sold in all of our products, we've had all the cannabinoids that came out of the plant, the minors, the terpenes included. and that's through all of our products. So I didn't want to be focused as a CBD company. It kind of irked me. I feel like we are more of a health and wellness company. And it just so happens that the main ingredient that we use, if you will, happens to be from a cannabis slash hemp plant. I mean, it's one and the same, right? We've gone through that today. And look, and we've gone through some of this propaganda that a lot of the audience doesn't know. And it started back with Randolph Hearst, right? And I don't know if we want to get into that or another time, but
1937 Marijuana Tax Act. Yep, sure.
yeah. And so there's so much stuff out there showing where Randolph Hearst, he had paper mills. Well, the hemp plant, the hemp trees were actually encroaching on his paper farms that he had in the Philippines. So in his newspapers, he literally put in the ads where it's a white woman getting busy, if you will, with the brown man and calling it reefer madness and marijuana and that slang term versus just cannabis. And then they also had put out stories of people going nuts and like a young guy killing his parents because he's high. This is false, right? It's crazy. And I love Joe Rogan. Joe Rogan talks about this all the time, right?
Sure.
So, and it goes into Nixon in 71 in the drug war, right? So all the hippies, anti-Vietnam movement, if you will, they all know, the politicians are like, no, they're all smoking pot. This is how we're going to crack down on them.
And by keeping it Schedule 1, they get arrested and felons can't vote. So yes,
all that, right? All of that. And yep. Taking away our freedom to use something that we want to use for a variety of reasons, whether it's recreational or it's from a therapeutic decision from the consumer making that choice themselves. We've unpacked very well, and we'll have you back because we could talk about so many facets, so many things. We could do a whole episode on Full Spectrum, on sustainability. Sustainability goes right to, by the way, talking about false claims. Yes, William Randolph Hearst. I don't know. So watch out for false claims, people. We're not allowed to make health claims, but they were allowed to make those claims. Hey, guys, we're going to have to wrap up, but this is why I'm proud to welcome Aspen Green into the Green Bee Life Hive, because we believe in partnering with brands that care as much about what goes into the bottle as you care about what goes into your body. And Brandon, Stephanie, Rebecca, I thank you guys so much. And I look forward to doing part 2 and really diving in to the different ways you can consume for what different effects, we're not going to say benefits, and the different delivery systems there are, because there's lotions, there's potions, there's pills, there's soft gels, there's tinctures. And you guys, as being part of the customer care team, we've got our retail specialists and we've got someone with the cultivation background who could talk a little bit about all of it. So guys, thank you so much, and I look forward to having you back. Hey, if the audience would, they can feel free to call directly at 1-888-578-5900. You can talk to Rebecca, Steph, Bonnie, or Adam, and the website's aspengreen.com. We also use drinkaspengreen.com coming out, and then bolodrinks.com is coming too. And by the way, you'll be talking to these gals right here when you're asking about Bolo as well. Thank you so much. Fantastic. Thank you for letting our audience know how to get in touch with you. That was going to be my next question. Guys, if you can hear this live on KCAA radio, which you're listening to right now, but also it'll be archived on all the major third-party podcast platforms, iHeartRadio, Spotify, Amazon, Apple. But if you go to greenbeelife.com, listen, and you go to our show page for this episode,
We'll have all their contact information. And who knows, maybe I can even get them to give us a little special affiliate link for our Green Bee Life Hive. Hint, hint, no pressure. But all right, guys, thank you so much.
Well, why don't we just do Green Bee Live, right? Let's go Green Bee. You want Green Bee Life, Maria? We'll go Green Bee Life and get 20% off.
Whoa, Green Bee Life 20. You heard it here, guys. It'll be on the show page. Green Bee Life 20. I love it. I love it. Oh, thank you. Thank you, guys. We'll
Thank you.
soon.
Thank you.
All right. So here's the truth. The more we know, the better we choose. So before you buy your next CBD product, pause and ask, does it follow? Does this brand publish lab results? Aspen Green? Yes. Are they third-party lab tested? Aspen Green? Yes. Do they use clean extraction methods and organic practices? Aspen Green? Yes. Or are they just hoping you won't ask those questions? Hey, if today's episode raised your standards or inspired you to try CBD for the first time, head over to greenbeelife.com. Go to our show page for this episode with Aspen Green. Use Green Bee Life 20 and they'll hook you up. Feel free to call them. We'll have their phone number. You could talk to their customer support. Stephanie, Rebecca, we didn't meet Bonnie, but they've got a whole Learn It team over there. And so if you care about clean, responsibly made CBD, let your elected officials know. Remember, the FDA has yet to create meaningful guidance on hemp-derived CBD. And that's left good companies like Aspen Green to figure it out on their own, while less scrupulous ones muddy the waters. It's time we demand action and definitely support the brands that are getting it right. So consider supporting groups like the U.S. Hemp Roundtable, or reach out to your representatives and tell them you expect clear, sensible regulation that supports safe access and honest innovation. Because the remedy you're looking for, it might not be in the prescription bottle. It might be in the plant if we protect it. Thank you for tuning in. If you found today's episode helpful, please share it, follow the show, and leave a review wherever you listen. Every share helps us grow and helps others know. Cannabis isn't about getting high. It's about getting well, being informed, and living fully. And here on Just Say No, where curiosity's queen, we'll always keep it real, relevant, and rooted in truth. AspenGreen.com was today's spotlight. Thank you, everybody. Have a good, safe week. Just Say No is a Green Bee Life presentation airing live weekly on Friday afternoons from 4 to 5 p.m. Pacific on KCA Radio and KCAA TV. Archived audio episodes are on Green Bee Life, greenbeelife.com, iHeartRadio, Spreaker, and most third-party major platforms. For archived videos, check them out on GBL TV, on Green Bee Life, YouTube, and Rumble. To follow us, our Instagram and Facebook is at Just Say No Radio. To apply to be a guest on the show or for sponsorship and advertising opportunities, go to greenbeelife.com/Just Say No, and feel free to reach out to me, Maria, for any questions. I'm at maria@greenbeelife.com, or call me at 818-758-6925.
Did you know THC and CBD are just two of more than 100 cannabinoids?
At Green Bee Life, you can watch GBL TV with an evolving slate of original programming.
I'm going up.
From a diverse group of on-air personalities.
I want my GBL TV.
Where we cover everything from pets to wellness, compliance, social equity, culinary arts, sustainability, and much, much more. You can learn from articles on our journal, And you can shop on Know and Go for carefully curated, high-quality products for a conscious lifestyle. Watch, learn, shop.
Green Bee Life, changing the way the world sees green.